So we are reporting 867 newly locally acquired cases from yesterday, and in addition to that, a number of cases from the 2 previous days. 140 cases which were reportable from the 27th of September and 9 cases which were reportable from the 26th of September. These were due to a software update by a third-party vendor who supported one of our pathology providers. This meant that test results were not reported to the department's central system, but were nonetheless still reported to all of those people whose tests were undertaken, including those positive cases who received their advice as per normal from those pathology providers. That software problem has been rectified by our partners in the pathology contracting area, and this fortunately did not have an impact on either the people concerned getting their test results, particularly the positive cases, and more importantly, the advice from the pathology advisors to both isolate and await further information. These number of cases now bring us to 9,261 active cases of coronavirus in the state. Sadly, I have to report that 4 further people have passed away from COVID over the past 24 hours. A gentleman in his 80s from Whittlesea, a woman in her 80s from Hume, a gentleman in his 70s from Hume, and a woman in her 50s from Whittlesea. Can I take this opportunity to pass on our deepest condolences to the family, friends and communities of those people who have seen their loved ones pass away. We also have 375 people with COVID in hospital at the moment. 81 of those are in intensive care and 61 are on a ventilator. Of the people who were in hospital yesterday, 78% were vaccinated and 17 were partially vaccinated. In regards to tests, 49,450 tests were processed yesterday, bringing us to over a 2.5 million figure since this current outbreak commenced. We also had 35,160 vaccines administered in our state-run hubs and a substantial additional figure through our primary care partners as well. This brings us to, as of yesterday, over 48% of the over 16 population receiving the 2 doses of COVID-19 and approaching 79% for the first dose, which gives us that number to tip over into the 80% single dose trigger for those modest relaxation measures that are due to come in from 11:59 p.m. tonight within the next reporting period.